spokesman for the Lansing Police Department, it is my job to report on recent crimes, and many times I find myself reporting on serious violent crimes where either the victim or suspect is a young man of color. Sometimes they are both. Most troubling is that when these incidents occur, it is often too late for the young man. More times than not, the systems that this young man has been through has failed him. We are here today to raise awareness of this problem and, most importantly, to dialogue solutions on how to prepare our young men to succeed in a struggling Michigan economy. It is now my distinct pleasure in introducing you to the chairman of the Ingham County Initiative, Dr. Clarence Underwood. Dr. Clarence Underwood is Athletic Director Emeritus, Michigan State University, and a chairman of the Ingham County Change Initiative.
The initiative is organized around workshops and also work groups. So we have work groups consisting of health and child welfare that is coordinated by Dr. Renee Kennedy and Dr. Deli Davis. We have education that's coordinated by Mr. Randy Bell and Mr. Jim Davis. We have employment, economic development, that is coordinated by Dr. Doug Stites. We have juvenile and criminal justice that is coordinated by Mr. Stuart Dunnings and Ms. Zeminski. We have the media, Angela Austin. Youth, Angela Austin. Data, Dr. Hiram Fitzgerald. We have resource development, Teresa Kometz, and public relations by Chris Holman. So these individuals, you're going to see them a lot today talking about their programs, their work groups, and what they're trying to accomplish for this Ingham Change Initiative, which is designed to provide opportunities for young people in this county, primarily young men of color, but it's focusing on all the young people in Ingham County.
My task is to give you a brief history of the work of this commission, how it was formed, and what our directions have been to date. The work that the Ingham Change Initiative has undertaken in this community is heavily influenced, has been and will be heavily influenced by national work that was done through a national commission known as the Dellums Commission. Those of you who are old enough remember Ron Dellums, the representative from California. That was about four or 5 years ago. We were, by we I mean my company, served as senior consultants to that organization and to that work. We brought the work back here to Lansing, and through the Dellums work, it was determined that over the past 25 years, there have been various policies, a series of public policies that were enacted that have had a negative effect on the population that Dr. Underwood just spoke to, basically young males of color. These problems have had a cumulative and a hardening effect, not only on the young males themselves, but on the communities that they've come from. We brought the idea back to Lansing, and in order to move the Dellums work forward, the Ingham Change Initiative was in fact organized. Dr. Underwood is the first president of that organization, and actually the story is how much time and effort it took us to come up with our chairperson, because we had to come up with a person who had all of the qualities that any community would really respect. And so after about 6 months of hard work, we came up with Dr. Underwood, and he's not disappointed us. The first year of the initiative, which happened about 3 years ago, we formed a partnership. The initiative itself, Jane Addams Hull House in Chicago, and Public Policy Associates. And we formed that partnership so that we could begin to look at local issues, local policies, not national policies. And so whereas our work is really guided by some of the national policies, we've actually tried to localize that work so that we can see what's going on here in Ingham County. 2 years ago, we said to you that we had formed, that we had our structure in place, and we were prepared to go to work. And I am prepared to say to you today that we did go to work. And what you will hear is our progress to date. What you will hear throughout today is the progress that the Ingham Change Commission has made thus far. And our themes will be focused around 3 areas: research, empowerment, and engagement. Research, empowerment, and engagement as ways of influence policies, programs, and procedures that create the disparities that we will be identifying. Throughout the day, we will talk about research, empowerment, and engagement to influence the disparities that we will be identifying to you throughout the day. Important to our process will be decision points. At what point in a policy and how that policy is implemented are there decision points? And who do those decision points affect? We continue to maintain that every conceivable area that we have looked at in Ingham County, every area in health and child welfare and education, economic and workforce development, juvenile justice, criminal justice, and the media, everyone has had a negative effect on the populations that we're talking about. We also know, however, that all young people are at risk. And so whereas we are saying we focused on young males of color because that was a national study, we do know and we do have evidence that some of the other populations are also affected, particularly youth. And so you'll hear something about that as we move forward. Decision points are the points that really affect which direction, what services, what help, whether there's support in the community for these young people. Okay, so it's the decision points that we are looking at. In order to identify reasons for many of the disparities, we have to look at this work through a racial, ethnic lens first, and then we look at it for other reasons. But the basis of the work, the body of work, was looked at through a racial, ethnic lens. And we'll continue to do that here as we move forward. So, for today, in order to begin our discussion, we have 2 work groups that will be providing information to you very briefly. And that will be the education work group chaired by Randy and Jim Davis, Randy Bell and Jim Davis. And then Dr. Davis, Dealer Davis, will talk briefly about health disparities. And then hopefully we can move on to youth. So, Randy and...
I'm Randy Bell, County Extension Director for Ingham County MSU Extension. Jim Davis is Deputy Superintendent for the Lansing School District, and we've had the pleasure of being able to co-chair the education work group for the Change Initiative. The real heavy lifting gets done by the work groups. You've got a chance earlier, and if you look around the room, you'll see our Ingham Change Initiative well represented here today. When you connect names with faces, you see that these are folks who are identified for their ability to really reach into the community and deliver a message. And that's the key reason why we asked them to populate the initiative's commission. Yet at the same time, we knew that data needed to be analyzed and that we needed to take time, a lot of time, to dig down deep into what data was available or what was not available to then begin to take a look at what our recommendations would be. And so again, along the lines of good representation, our education work group had both teachers and administrators from the Lansing School District, staff from Lansing Community College, staff and faculty from Lansing Community College and from Michigan State University, in addition to the Ingham Intermediate School District. So we had the opportunity over the last year to analyze that data, to begin to look to see what we had available to us and what was still missing in order for us to make some recommendations. We're not going to go into the gory details of that, but I'm going to have Jim talk a little bit about the 3 areas that we chose to focus our initial work on, why we chose those 3 areas to start with, and what we think some of that means for better outcomes for the young people in our community. Jim?
Thank you, Randy. As Randy said, we've chosen these 3 areas mainly because we believe that these 3 specific areas affect all students and are negatively affecting specifically our young men of color. When you think of high school graduation, when you think about our educational systems, obviously that's the outcome we're looking for. Currently, it is easily the most important outcome at the beginning of a young person's educational career. It starts in early childhood education, gets through elementary, middle, and high school, and of course leads on to higher education. And that's why we're represented by all levels of our community who have an effect on these areas. But on-track graduation right now is one of the most critical talking points that you're hearing in the state of Michigan and nationwide. So we're talking about cohort groups, a student being able to come through school with their class and graduate on time. Now there's a lot more to it than just starting as a freshman, ending as a senior, and then you graduate. Along the way there's expectation of what level of achievement a student is going to have and what skills they're actually going to accumulate along the way. So we're trying to look at all the data that shows what's really happening. It's not that no students are graduating. It's not that our schools are totally ineffective in terms of educating our children. But it is definitely an issue when we have disparity in terms of access to support or in terms of access to the final outcome, which is graduation. The engagement piece, the MyFi assessment, is a risk and protective factor assessment that students take to let us know. So what's keeping you from being successful in school? What are the things that are happening to you? And it's not identified by student, it's identified by who they are, not on a personal level, but who they are as a student within any school district. We're working very hard to get that assessment given out across the county so that we get more data from just our largest school district, which I happen to represent. But my representation on the commission is not about my district. It is about all of our districts, and we are getting more and more involvement from all of our districts, because no matter where you look, if the problem, it's one of those cliches, if it's happening to one of us, it's happening to all of us. And that is what we're seeing. We're seeing our young men of color struggling in every area of our community and also succeeding in every area of our community. So what we're trying to do is look at what are the things that are causing them to succeed, what are the things that are causing them to struggle. Because if you don't look at the things that are being successful, you only focus on the problems and forget why you're getting positive outcomes as well. So that student engagement piece is critical, and that's where the analyzing of countywide data and collaborative planning. We'll be working with all of our superintendents and all of our districts because they are all represented by our children. We're also looking at suspension and expulsion policies for a very obvious reason. You cannot teach to an empty chair. A student who is not in school cannot graduate from high school. And yet at the same time, what you'll hear if you talk to our educators, given the level of pressure they feel to create those outcomes, they want their students to be in those chairs, listening, actually on track with their work, not creating any kind of disturbances that lead to suspension and expulsion. Now there's a very big difference between suspension and expulsion. Suspension is temporary. Expulsion, according to Michigan law, can be permanent. So when we have a disproportionate number of our suspended and expelled students as young men of color, we have to look at it. It's not that we're saying that there aren't obvious reasons why students fall into these categories, but we want to make sure that the reasons are not based on inherent bias, misconceptions, and not following the policies that already exist. And what we're going to do is look at those policies and say, what changes can we make? Because it's not simple enough to say that a student should be suspended or they should be expelled. It's what happens then. So are they done just because they've been suspended? Are they done just because they've been expelled? And we also know, unfortunately, that if they fall into either one of those categories, there are people in this room who will see them later. They will be sentenced to other problems along the way that are much worse than not being in school.
I see this as more than just an issue of young men of color. This is a community that I live in, and as you all know, we live in a global community. If you think about the population of Michigan alone, it's about 10 million, and we have emerging economies in China, India, that have billions of people who can actually mobilize and get businesses very quickly because of the cheaper products that they have. This becomes an economic security issue for our community. We cannot afford to have one member of our community left behind because the competition is very strong. And I think that we have to think about this from the point of view of how every time we have a member of a visible minority or any member of our community who's left behind, either in the healthcare area or education or any of the other areas that we've mentioned, how that translates into their economic future. Businesses today look at the health of their community in terms of determining where they're going to locate. And as much as when we have healthcare as a priority and as an issue for our youth, and our healthcare are not adequately, our youth are not adequately served by their health, they're more likely to have problems with school, as you've heard, and school dropout leads to truancy in other areas, and of course, the economic security becomes an issue. So for me, this is an issue for me as this is a community that I'm living in. I believe that this is an economic security issue for our whole community, and that's sort of the approach we've been taking from our community, from our committee's point of view. So one of the things that's pretty clear is that there's a huge discrepancy in terms of healthcare outcomes for young men of youth versus their Caucasian counterparts. If you think about a third of the population, of the male population, are young men of youth, but the deaths for youth is about twice. So about 66% of all the deaths that occur in youth occur amongst young men of youth. They're more likely to have problems like obesity, asthma, a whole bunch of other issues that leads to trouble at school, which then leads to them being more likely that they're going to get suspended from school, and more likelihood that they're not going to actually have an economic security, which affects the whole community, no matter who you are, because that affects the kind of businesses that are going to want to locate here. That's a challenge for me, it's a challenge for you, it's a challenge for everybody who lives within our community. So the areas that we've been focusing on to try and get more information, and actually the theme of our message today is that we need more data. We're not ready to make policy recommendations yet, but we need more Ingham County specific data, and that's really the recommendation we're going to be making, is that we need more data. We've been looking at the area of health insurance and how there are discrepancies within health insurance that limit the access of young men of color to getting health care. And it's actually beyond health insurance. As we'll talk about later, I'm not going to delve into it too much right now. There's more to access than health insurance, but that's certainly a major part of access. Dentistry is another major area we're focusing on. We know that dental care access is a huge priority for our community. And if you think that dentistry is not important, all you have to imagine is somebody who's had some issues with their teeth for a while and how that impacts their whole body and their ability to function on a daily basis. So we're going to need more data there, and we can talk more about that. There's a concept of medical home that has emerged nationally, and the idea that if you happen to have a child or a family member who has any kind of a chronic medical problem, to try and coordinate the care for these people, either your child or yourself, when you have to see multiple specialties and perhaps a lot of other allied health services, can be quite daunting. And this is quite overwhelming for several people who try to navigate the healthcare system. And the national norm is that every single child and every single member of a family should have a medical home. And there are studies showing that if you're part of a medical home, you're much less likely to show up in the more expensive emergency rooms for your care and urgent care centers. So that's one area we're focusing on as well, is to try and get some information for medical home access, which we believe will impact the long-term health care for our youth of color. Mental health and substance abuse services is a huge one for us. There's surveys, local survey data that shows that 75% high school children have had a drink in their lifetime, and 40% of them have had a drink in the last 30 days. And we know the impact of alcohol and other behaviors at that age, and so that's an area we're looking at. And the final area we're looking at is something we're calling cultural competency. And so there's a lot of information out there about healthcare and healthcare outcomes, but really what we're trying to get at is the ability of people from different backgrounds to access the healthcare system. And that's often a challenge. There's not a lot of information out there. And how do we coordinate all this information and make sure that this access becomes a reality for the young men of youth, and actually then ultimately for the whole community? Because there's no system we're going to design that's only going to serve one group. It's going to serve all of the groups. But we're just trying to make the point that this is really a community issue. It's not about young men of color only, but our whole community is going to be well served if we can tackle these issues. Thank you very much.
To do. Both groups have spoken specifically about the research question. Why is it that? Why is it that? In all of the areas that we're looking at, the question remains, why is it that this policy affects this group of people differently than it affects the other group of people? That's a research question. So as Dr. Davis said, we need more data. We're getting down into those data, and we're looking to answer that question. Why is it that this is the case? Once we have that information, we're much able to strategize and develop programs to meet the needs of those populations. That takes a while, and so that's what we're asking for, more time, okay, as we delve down. The mission. That's the mission of the commission. That's a brief history, and that's the information that we want you to have this morning regarding what we've been doing for the last 1 year, okay? The work is hard, the work is tedious. Finding data, as Jim Davis has said, is really tough. Sharing those data is even more tough. And having honest discussions and dialogue about what now that we know the story. That's the toughest part of all, okay? Now that we know, what is it that we're going to do? And this group is committed to working in that regard. I'd like now for our Dr. Kennedy to come and sort of tell us, or give us her impression of what she's heard so far.
In this community, we believe that talk is action. We believe that words create, that conversations establish relationships, and that dialogue facilitates solutions. And so we really want to acknowledge the sponsors of today's activities, and that is the Morehouse School of Medicine Center for Health Disparities, and that is under the direction of Dr. Henri Treadwell. We met and established a relationship with Dr. Treadwell several years ago when this community had the good fortune of being funded by the Kellogg Foundation Community Voices grant, at that time under the direction of Dr. Treadwell. It is then that we established relationships that are now serving us really well as we tackle this somewhat intransigent problem. But we believe that there are solutions out there, and so it's not a matter that talk is cheap, but talk is bringing us to a point of solution. And so we do very much want to thank you, members of the media, for engaging us in this dialogue that leads us to solutions not only for Ingham County residents, but for the region and for the state of Michigan.